Men over 50, here's a question your doctor probably never brought up. Can masturbation actually help your prostate or make things worse? The answer might surprise you, and it could change how you think about your health and quality of life as you age. I'm Dr. Elizabeth Rains, board certified urologist with 15 years of experience helping men take control of their health, especially when it comes to sensitive topics like this. Today, I'm breaking down the real, science backed facts about self stimulation and prostate conditions. No stigma, no awkwardness, just the truth. Here's what most men don't realize: your prostate, that walnut sized gland under your bladder, naturally gets bigger with age. In fact, 80% of men over 50 deal with benign prostatic hyperplasia, BPH, which can cause annoying urinary issues and affect your daily life. But here's the twist: recent research shows that regular ejaculation, including masturbation, may actually protect your prostate. One major study found that men who ejaculate 21 times a month have a 33% lower risk of prostate cancer compared to those who do it less frequently. And it's not just about cancer risk. Regular self stimulation can help reduce stress, improve mood, and give you a sense of connection with your body, all of which are vital for mental health and emotional balance as we get older. In this video, I'll explain exactly how masturbation impacts your prostate, the psychological benefits for men over 50, and why this simple, natural habit could be one of the best things you do for your long term health. Here's where things get really interesting, and this is backed by solid research that most men have never even heard about. A Harvard study following over 29,000 men for 18 years revealed a stunning finding. Men who ejaculated 21 times per month or more had a 33% lower risk of prostate cancer compared to those who did it just 4 to 7 times monthly. This isn't just a minor difference, this is potentially life saving. Why does this work? Regular ejaculation helps flush out the prostate, clearing it of potentially harmful substances. Think of it like regularly changing the oil in your car. You're not letting harmful buildup accumulate and create problems down the road. For men over 50 dealing with BPH, that enlarged prostate I mentioned earlier, this becomes even more critical. When prostatic fluid sits stagnant, it can trigger inflammation, increase infection risk, and worsen those annoying urinary symptoms. Regular release helps keep the gland functioning properly. But the benefits don't stop there. Self stimulation maintains healthy blood circulation to your genital area, and this is crucial for men concerned about erectile function. Every time you become aroused, you're literally exercising your sexual organs. Fresh, oxygen rich blood nourishes the tissues, maintains their sensitivity, and helps prevent the use it or lose it scenario that's common after 50. The American Journal of Medicine published research showing that men who had erections less than once per week were twice as likely to develop erectile dysfunction compared to those who had them more frequently. Your body simply needs this regular blood flow to maintain health and function. Psychologically, regular sexual activity helps maintain confidence and reduces anxiety about sexual performance, something that becomes increasingly important as we age. The bottom line? This isn't just about pleasure. It's about proactive health management, and the science backs it up. Here's another critical finding that can make a real difference in your daily comfort. A major urology study found that men over 50 who ejaculate 2 to 3 times per week report noticeably fewer urinary problems related to prostate enlargement. We're talking about issues like a weak urine stream, waking up multiple times at night, or that constant feeling you can't fully empty your bladder. The science behind this is straightforward. Regular ejaculation acts as a natural pressure release for your prostate. It helps flush out cellular debris and inflammatory substances that tend to build up in the gland over time. Think of it as your body's own maintenance routine. When you keep things moving, everything functions more smoothly. But let's be clear: masturbation is not a magic bullet or a standalone cure for prostate problems. Instead, it's one supportive habit within a bigger, holistic strategy. For the best results, combine regular ejaculation with other proven approaches. Eat a diet rich in lycopene and omega 3s. Maintain a healthy weight to reduce inflammation, and strengthen your pelvic floor with targeted Kegel exercises. Together, these habits create the strongest foundation for protecting your prostate and overall well being. Of course, every man's situation is unique. If you're facing serious prostate conditions like advanced cancer or acute prostatitis, self stimulation may not be safe or comfortable. In those cases, the prostate and surrounding tissues are often very sensitive, and any extra pressure could cause pain or interfere with your treatment. That's why it's essential to consult your healthcare provider for personalized advice before making changes to your sexual routine. Let's talk openly about something many men are quietly worried about: the fear that masturbation could somehow make a prostate condition worse. If you've ever felt anxious or uncertain about this, you're absolutely not alone. These concerns are completely normal, especially when dealing with health issues that often carry stigma. Here's what I want you to remember as your urologist: self stimulation is not something to feel embarrassed or guilty about. In fact, it's a form of personal health care, just like taking your prescribed medication or going for your daily walk. When you shift your mindset and see sexuality as a natural, important part of your overall well being, you can build a much healthier and more positive relationship with your body. Research consistently shows that for most men over 50, even those with prostate enlargement, moderate, mindful sexual activity can support both mental and physical health. You're not only maintaining sexual function and confidence, but also actively contributing to prostate health, circulation, and quality of life. But here's what really matters: every man's situation is unique. What works for your friend or a neighbor may not be right for you. That's why I always encourage honest, open conversations with your healthcare provider. Don't let embarrassment keep you from getting answers and advice that could make a real difference in your comfort and well being. Sexual health doesn't have an expiration date. Whether you're 50, 60, 70, or beyond, you deserve to feel confident, comfortable, and connected to your own body. Taking care of your sexual wellness is just another way of taking care of yourself, and that's something to be proud of. Before you go, I'd love to hear from you. What questions or concerns do you still have about prostate health or sexual function? What topics would help you feel more confident about your health decisions? Leave your thoughts in the comments. I read every single one, and your questions often inspire my next videos. If you found this information helpful, please subscribe and share this video with any man in your life who might benefit. Knowledge is power, and you deserve to have it. I'm Dr. Elizabeth Rains, and I'll see you in the next episode where we'll continue exploring the health questions that matter most to you.